Healthcare plans come in various forms, each designed to cater to different needs and preferences. Understanding the distinctions can help individuals make informed decisions about their healthcare coverage. Here are some key types of healthcare plans. HMO plans emphasize preventive care and require members to choose a primary care physician, PCP. Referrals from the PCP are typically necessary to see specialists. PPO plans offer more flexibility in choosing healthcare providers. Members can see both in-network and out-of-network providers, although the latter usually incurs higher out-of-pocket costs. EPO plans combine elements of HMOs and PPOs. They offer a network of preferred providers, but coverage is limited to in-network services, except in emergencies. POS plans blend HMO and PPO features. Members choose a primary care physician but can see out-of-network specialists with a referral, albeit at a higher cost. HDHPs have lower premiums but higher deductibles. They are often paired with health savings accounts, HSAs, allowing individuals to save money tax-free for medical expenses. A federal health insurance program for individuals aged 65 and older, and certain younger people with disabilities. It consists of different parts, including hospital insurance, Part A, medical insurance, Part B, and prescription drug coverage, Part D. A state and federally funded program providing health coverage for low-income individuals and families. Eligibility and benefits vary by state. Catastrophic plans are designed for young, healthy individuals. They have low premiums but high deductibles and mainly cover essential health benefits after the deductible is met. Short-term plans offer temporary coverage for individuals in transition, such as those between jobs. They may not cover pre-existing conditions and often provide limited benefits. Many individuals receive health insurance through their employers, who often contribute to the premium cost. These plans can vary in coverage and cost-sharing arrangements. Choosing the right healthcare plan involves considering individual health needs, budget constraints, and preferences for healthcare providers. It's crucial to carefully review plan details, including premiums, deductibles, co-pays, and network coverage, to make an informed decision.